Hi, my name is Amy Stevens. Selma Flanders. Philip Stevens. Hope Flanders.
And Will Flanders.
Now I'm going to ask you all to imagine that you have a 4-year-old son who's been complaining of stomach pain for the last couple of days. Suddenly one day he begins to really complain with pain. He's rolling around with crying, holding his belly, and you take him to the emergency room. There you find out that he's having an acute pancreatic attack. After years of doing having acute attacks in hospital stays, you find out that he has hereditary pancreatitis. Hereditary pancreatitis is a rare disease. It is estimated to account for only about 3 to 6% of all pancreatitis cases. It is a genetic condition. The most common form of this condition is the mutation of the PRSS1 gene. They also test the FIG1 and the CFTR genes whenever they're testing for it. Since so little research has been done, it's hard to determine if these are the only genes that affect whether or not you get hereditary pancreatitis. The scenario I asked you to imagine was what happened whenever my son came down with his first attack of pancreatitis. He was diagnosed at the age of 6 with hereditary pancreatitis, and now at the age of 8 he's in pain every day. It affects his everyday life, and is now even on a feeding tube. I'd like to start by telling you what hereditary pancreatitis is and what causes it. Hereditary pancreatitis is defined by meta-phase article hereditary pancreatitis as a genetic disease that affects the production of enzymes within the pancreas. It is associated with recurrent pancreatitis or the inflammation of the pancreas. The first episode of hereditary pancreatitis usually happens in childhood. According to the genetic home reference, hereditary pancreatitis only needs one mutated gene donated from the mother or the father to affect the child. In lots of cases, this disease is a result of a mutation in the gene referred to as the PRSS gene. It accounts for approximately 65% to 80% of individuals with hereditary pancreatitis. Basically, what happens during an attack is that the pancreas makes enzymes like it would regularly when you eat food, but instead of releasing them into your stomach to help you break down food, it releases them inside the pancreas, and the pancreas begins to basically digest itself. It is very painful. A diagnosis can only be obtained through genetic testing. Now I'd like to talk about the symptoms of hereditary pancreatitis. The symptoms, for the most part, are your standard symptoms that all people with this disease have: vomiting, nausea, diarrhea, extreme abdominal pain, joint pain, extreme fatigue. Even diabetes and pancreatic cancer can be a result of hereditary pancreatitis. Now that we've discussed what it is and what the symptoms are, I would like to discuss how the disease can be treated. Since the disease is so rare and not a lot of research has been done about it, there are very few choices in treatment. An extremely low-fat diet is one choice. Pancreatic enzyme replacement therapy is another thing that they can do. And basically what this is you take medicine to release the pancreatic enzymes that your pancreas usually makes whenever you eat food, and it takes care of digesting the food for you, and so your pancreas doesn't have to work as hard. Surgery can be an option. An article written by the Pancreatic Board at the University of Minnesota, patients with mostly problems in the small ducts may benefit from procedures such as the Whipple, and patients with mainly large duct damage can be helped with the Fray and the two-stone procedure. In severe situations, there is a surgery that can be done called pancreatitis with auto-input sensor. Dr. Singh from the Johns Hopkins Pancreatic Center wrote, the selection of the optimal candidate with chronic pancreatitis for total pancreatectomy, with or without islet cell autotransplantation, is a complex and difficult process. In the total pancreatectomy, surgeons remove the entire pancreas and spleen, gallbladder, common bile duct, and portions of the small intestine and the stomach. It is an extremely difficult surgery for people to recover from. Islet cells are harvested and implanted onto the liver so that the patient does not become a diabetic. November is Pancreatic Cancer and Disease Awareness Month. Since this is a disease close to my heart, I wanted to share awareness with all of you. Hereditary pancreatitis is very rare and hard to diagnose. It has extreme symptoms such as throwing up and fatigue and extreme abdominal pain. It can even cause pancreatic cancer and diabetes. Spreading the word on rare diseases often means that this cause will get more money for research. I hope in my lifetime hereditary pancreatitis is cured. It is a horrible disease that is painful and affects everyday life of my son. And I'm hoping that by raising awareness, the more people will be willing to raise money for this cause. I'm very involved in the Childhood Pancreatitis Foundation. If you would like more information or to donate to this wonderful cause, their website is located in the bottom of the screen. I thank you all for your attention tonight.